So here, you better take down some notes.
Well, yep.
Okay, just take down some notes, okay, because this is what you are to complete during that class time. And again, you have the entire portion, that morning portion, from 8:30 in the morning, and you're expected to be here at 8:30 that morning until we break for lunch. So you'll have plenty of time to do this.
How's it look?
Oh, well, let's face
Now,
it.
Yeah, that's what I want.
I will also provide to the group a packet, if you will, of multiple information in order for you to pull the information, not just from your book, but also from other sources, as well as, okay, I got a drug book right here for nurses. And I will also provide to you the advanced book so that you can have the necessary stuff available to you in order to complete this. Now, the very first thing is that you'll need 4x6 cards. If you do not have any or can't get any, let me know. I'll provide those to you as well. But you are to have 4x6 cards.
Index cards, right?
Now, I give specific instructions for a reason. Failure to follow my instructions, I'm not going to be a happy camper. Follow my instructions and follow them to a T. There is a method to my madness, okay? Because when you're out there in the field working with either an advanced or a paramedic, you're going to be delegated a task, and it is to be fulfilled to the T. Not half-beeped, okay? To the T. A life depends on it. So, when you look at the 4x6 card, okay, the very first top line is kind of like red, or some of them are, and then the rest of them are like little blue lines that come up underneath there.
Yes, ma'am.
Okay, so the very first thing at the top is that I want to know the drug name. Now, I'll give you an example as we kind of go along. Okay, so drug name,
Robax.
aspirin. Okay? The very first line is that I want to know the class of that medication. Something like, this is a pain reliever. What we use it for in the field is not necessarily for pain relief, but it is a platelet aggravator. Which means that it inhibits the platelets from sticking together to form a clot. Okay, the next thing is that I want to know the action of that medication. Which means it inhibits platelets from forming clots, something along those lines. Again, once you start doing the research on these particular medications, you'll totally understand the action of those medications. The next thing is, what is the indications for this medication? So when we give aspirin in the field, or we help assist our patients with their own aspirin or something, why do we give it? It's for like acute coronary syndromes, AMIs, angina. These are some of the indications or the indicators of why we give the drug to the patient. Then under that is the contraindications.
What's that last one?
Angina, A-N-G-I-N-A.
We didn't learn that yet.
Oh,
Correct. So, aspirin, there's a lot of people that are allergic, so we don't necessarily wanna get a,
That's why we ask, are you allergic to any medication?
yeah.
Ain't that right, sir?
Okay, the next thing I wanna know is the side effects of the medications. So side effects could be like nausea, vomiting, upset stomach, so forth. Again, you'll be doing your homework on this that day. Okay, the next thing is precautions. Now, let me explain what I mean by precautions. When we give a patient a medication, we have to be very precautious with certain circumstances and certain groups. Pregnant women would be one of these. See what I'm saying? Because of the fact that the medication can cross through the placenta into the baby's blood, this is a precaution. It doesn't say it's not a total contraindication, but we want to be very precautious. We want to ensure that if we're not sure, we need to be calling medical control going, look, she's complaining of chest pain, like classic symptoms of a heart attack, she's pregnant, do you still want me to give it? It's a precaution, it's not a contraindication, but I just want to pass that monkey on somebody else's back. Okay, that's part of the reason why we have medical control.
Being a trauma guy, severe hemorrhage would be in there too, right?
We're not gonna get aspirin.
It doesn't look like it.
Okay. So, the next thing is the actual dosage of the medication. Now, please pay close attention to what I'm about to say. Part of the reason why I'm supplying you with resources is that I want your drug card to be specific to the EMS world. You look up aspirin in that book right there for nurses, or if you look at another drug book for pharmacology students or pharmacy students, it's going to say 325 milligrams. That is not what we carry. The actual dose of aspirin in the field is 81 milligrams per tablet, and then the max is going to be 324 milligrams. So, with the dosage, I want to know the adult dose, the pediatric dose, as well as the max dose for both. And if it doesn't apply, just put not applicable or not indicated for pediatrics or something like that, if that's the case. I want to know the adult dose and the pediatric dose, as well as the max dose for each category. And then last but not least, is that I want to know the route of administration or the route of medication. Route of administration, sorry.
Most would be oral, like oral.
I hope it says it's oral.
Oral or PO. PO means by mouth.
PO.
PO means by mouth, per orifice.
Okay, I'm just trying to figure
Oral,
out how does that correlate.
Yeah, it's a Latin type thing. Or you could put oral, that's fine, but
No,
PO is what we kind of say. Okay, so is everybody tracking on the medication drug cards that you are going to be responsible for, that will be turned in for a grade?
So each person is making like their own set, or
Yes,
as a class?
and you can do it as a group, and
I
that's
was
fine.
gonna say as a group,
Yep,
we
you
like
do it as fine.
split it up.
Because again, you're learning together.
Yeah. Alright.
Okay, so small study groups. So each lab is, about 6 to 7 students, so that should be nice small study group size. Do it all together, just please. I'm gonna be running between here and that room, and so you need to social distance, okay? So if you wanna put the tables together and kind of go around the table, if you will, like in a triangle or something like that, or a square, that way you can social distance, so if anybody peeks in, you're around the table but spread, okay?
Just get like a cardboard cutout of a picture of the class all spread out in
No,
front of the door.
It's gonna mess up when they open it and the door, the class goes.
Just leave
I
it
And
know,
then
off.
it's
it's
like,
like,
just so, oh. So, okay, so this is what the drug cart should look like. Here are the medications you need to know.
Gotcha.
Aspirin is one of them.
That one. Ibuprofen.
Nitroglycerin or nitro is another one. Epi, and again, this is 1 to 1,000 for anaphylaxis.
Epinephrine. Good job, Seth.
Okay, and that's
Good job.
only, okay, 1 to 1,000, because epi comes in multiple concentrations, and this is specific for anaphylaxis, which is what we will be assisting our patients with, okay? Oxygen, because oxygen is a medication,
It is a drug.
and it is a glucose. Let me just put oral glucose, because that's what we carry, that you can help assist your patient with. I'm thinking of the paramedic level one.
What about
Fentanyl.
ibuprofen?
Crack
No?
cocaine.
Just
Robaxin?
boom in the back.
It's taking time.
Get the big syringe.
Remember what chapter that is? There it is. Okay.
We're good.
Chapter 14.
Yeah.
Oh, Narcan.
Yeah.
Isn't that for like
That makes me feel
heroin or?
Narcotic overdose.
Yeah.
Let me see.
Yeah.
Nitro, epi.
The whole time I've been thinking it's Narcan.
About the cocaine.
Oh, activated
I thought so too. What is it?
Narcan.
Oh, yeah, yeah.
That's in a
what
narc-
it was.
This all the stuff we can give as EMT?
You're not giving it. You are assisting your patient in giving it. If they have
Activated
it.
charcoal.
Oh, they
There's
have
a
it.
huge difference.
But they have it.
Mhm.
Activated charcoal.
Okay, so.
Brisket.
You should know that one from the military, 'cause they'll distribute that pretty freely.
What?
Activated charcoal.
What's that for?
Poison, or at least I remember.
It's for common monoxide poison.
Yeah.
No, it's not. I don't know. I don't know.
If you ingest something, I think it's
Okay,
an
so-
absorbent attach. That's what it would do.
Albuterol,
Mm.
and that's a MDI, which is a meter dose inhaler, which is what you will assist your patient with, not necessarily giving them the. I think that's all.
Damn, we can't give shit. Fucking sick drugs. I'm trying to get.
Okay, so.
Trying to use my mouth.
I'm trying to get rid of it.
Nitro, epi.
I'm gonna do this shit at home. I'm ready.
Yeah, this one too.
This take us like an hour. If that.
Okay,
Yeah.
so
That's
believe it or
not
not,
good.
chapter 14 is
That
only,
shit's long, bro. Maybe 3. There's a video of it long.
it's only like 12 pages
It
long.
feel that long.
A lot of it has a lot of
It's like a
pictures to
quiz or
it, if you
something.
will.
I think it's about 2
And
4 hours.
It kind of gets you into the mind frame of what and why we are going to assist our patients with these particular drugs. Now, those that progress into the advanced course, should you want to go there, these, as well as a couple of other drugs, you're going to have to know these inside and out. So if you learn them now, you'll already be ahead of the game in advanced school, because these will be actually the medications you can give, not necessarily, okay, well, I'm going to help you with this type thing.
Mm-hmm.
Okay.
I'll be there.
All right, so please, again, I'm gonna reiterate, October 1st, Lab 1, students will be in here doing BLS. Lab 2 students will be there from 8:30 until we break for lunch doing this, okay? Reading over this chapter together, and then putting your drug cards together. I will provide resources to you so that you can pull the information, the proper information that you need. Now, this is what I do not want, so pay close attention to what I'm saying. I do not want a regurgitation of what resource or resources I'm giving you on these medical cards.
put it all.
That's what I do not want, okay? Now, please be mindful, okay? Aspirin comes in a lot of different forms. We use chewable aspirin in the field. I don't want, Bayer aspirin and all the other, non-coated aspirin tablets and stuff like that, because that's not what we carry. I want it to be specific for the EMS world. Now, granted, if you take all of these resources and you lay them out flat on a table, because again, I have these in packages from different schools across the nation. So one card may be slightly different from another card that's slightly from a different card, but if you're seeing something redundant across the whole scheme of things, then maybe that's something you might want to pay attention to. But I don't want you to sit there and copy verbatim what's on that drug card, because some of it will not apply to us, because if it has a side effect that takes longer to see, why are we writing that down? Yeah, it's kind of good to know, but it's not something that I'm immediately want to be concerned about. This is what I'm taking, so take the time to think through your cards. But yeah, I don't want no freaking regurg. The only part that may be regurgitated is maybe the dosage. And there's a couple of them where you're going to have to sit down as a group and decide, okay, well, this one says this, and this one says that, and this one says this, so which one are we going with? You better collectively come up with one, okay? And it's always better to err on the side of a lower dose than something higher and you wind up overdosing your patient with, okay? So again, if there's any questions, obviously you can come and get me or whatever, and we'll kind of decide and talk about it as a group. But for the most part, I do not want the regurgitation of things. I want you to stay focused on what's pertinent to you, what is important to us. I need to know those side effects that's going to happen or possibly happen immediately, then I need to be prepared for it. If nausea, vomiting is one of those, guess what? I need to be prepared with my suction unit to be nice and handy dandy and a vomit bag so that I can be prepared for a possible side effect. If it doesn't happen, that's great, but if it does, at least you're prepared. Don't give me kind of like the action or the action of the medication in which you don't understand the action, okay? Because I had one of my advanced students do that. I'm like, okay, well, I'm the doctor, you're transporting a patient, so explain to me your action of the medication. And bless her heart, I mean, she was enthusiastic about these drug cards. She really got into it, and I appreciate that. But when you take and write down information that's up here, and you can't explain it, then I strongly suggest you don't put it. Okay? Keep it simple. Keep it simple, stupid. I know that's the last part, but just keep it simple for you, so that if a doctor comes up and asks you, all right, Sharon, why did you give aspirin to this lady? You can defend yourself, okay? Well, she was having some classic symptoms of a heart attack, and, this is part of our protocol, and she's had a heart attack before, and she had the aspirin, so we assisted her in taking her aspirin. Okay, but it's baby aspirin that we actually carry in the field that's chewable, because it's not like we carry water for them to drink and have you swallow something. Okay, so again, this needs to be focused in the EMS world, not the nursing world, the pharmacy world, the medical doctor world. It needs to be focused for us. I'll give you another example. Nitro would be another one. Okay, one of the side effects of nitro is hypotension. One of the contraindications is that I can't give nitro to someone that's taken an erectile dysfunction drug, like Cialis and Viagra and all that other stuff. Because a side effect of nitro is hypotension. Guess what? This is a vasodilator, and so is Viagra, and Cialis, and some of the other ones out there. So again, you have to kind of understand what you're doing and why. Okay, so again, I need to know that you understand a side effect of nitro. One of the things that's great about nitro is that when someone's actively having a heart attack, that heart attack situation automatically increases the oxygen demand that the heart requires. Because now it's struggling, it's working harder than it should. One of the great things about nitro is that it decreases the workload of the heart, because it decreases, here we go, ready? Pathophysiology. preload and afterload of the heart. So if we're decreasing the workload, then that means that the heart is working efficiently, much more efficiently than much harder than it was. So please understand why you do what you do behind giving medication or assisting someone with their medications when they have the indication that that drug meets, which is having a heart attack or having angina spells. Okay? That kind of makes sense? Who's your partner, Hannah?
Just me.
Okay, you'll get good notes.
Yeah.
Gotcha.
Okay? Everybody makes sense? Does this make sense? You'll catch up, I promise. He's got video,
Mhm.
so, no, you're fine, okay?
I always forget that thing's on.
All right, so any questions on what y'all are gonna be doing, cause that's what, next week, week after?
Next week.
Next week, next Thursday, okay? So next Thursday, this is what you're gonna be working on,
Group 2.
okay? Group 2 will be working on this, while group 1's taking BLS in here. So we kinda spread out and stuff, okay? Yes. Say that one more time, brother, I'm sorry.
The medium stuff.
Alright, so this is what y'all are gonna be working on. Do you any questions on this? Anybody need any clarification? Okay, please follow my instructions. If you need 4x6 cards, I'll be more than happy to provide this to you.
Let's go over it for you.
What?
Each person should have their own.
Set of cards.
Okay.
I was about to say, I got plenty.
I was about to say.
Already supply. I can get us all some.
Okay, well, I appreciate
I'm
that.
for real.
Benning starts reporting a massive
Well, I
amount
know.
of cards missing.
Well, and this is my thing, since you're gonna volunteer, just make sure you bring enough for a couple of sets per person, because this is gonna, the first set that you turn in is gonna be a scrub rope. We're gonna kinda sit down together and we're gonna scrub them, and then you're gonna turn in the second set for a grade. Okay, cause everybody freaks out, all my MT students freak out when they do these drug cards, so I don't know why, but, okay, so the first one, I want you to really think through what's important to be on this drug card. It not necessarily has to be everything, but I don't want like action of the medication, some one word. Okay, it needs to be an explanation so you understand the medication. Cause this is gonna be on your benefit, because it's gonna be your butt that's crawled, okay? Alright?
It's good. That's not a word, baby.
Okay, anybody have any questions before I race this off the board? Okay, cool.
So what
Alright,
does PL stand for again?
it's like,
Pig something.
It's
Latin,
on the
so it's
pig,
pig.
always pig.
It's on the
Piggy! It's a Latin term.
I
So
figured
bad
that.
news. Apparently, I did not cover it when I did the check.
Oh wait, chapter 12?
Yeah.
Oh, that's fine.
I
12's easy.
Yeah,
12
12
11's already posted.
That's fine. Yeah.
11's already posted.
12 is like
12 is common
26
sense, you just
questions,
need
yeah.
to reinforce. That was like 26 questions.
Yeah, that was easy.
Okay,
11,
So-
8.
That's it.
this is what we're gonna do since we have a lot of time today.
Yeah.
Is it raining when you came in?
We'll start with sprinkles.
Oh, that's fine.
It was sprinkle. It's not. It's fine. I mean, it's
No,
always
it's
gonna
like a
get worse.
60% chance of rain, so I was
Yeah.
just trying to see.
Sometimes we're gonna have to work in the rain though. This is again perfect training.
Yeah.
Yeah, well, I appreciate
Unless we're gonna be in the ambulance and they're gonna be like,
but,
we've
you
got a
know,
light
if people
sprinkle
say-
outside. We need to stay inside the ambulance. That light
Miss
sprinkle
Bush
outside.
don't
is
wanna,
not gonna-
she don't wanna mess up her hair. okay?
Joseph, Corona is getting real.
I can throw that thing on.
Hey, if it's helping clean it, you know, the rain will take that shit out the air, maybe.
Rinse it out.
I got y'all on the index. card.
Okay, so stand by for a second, let me see if we
Oh,
can.
we're attached
have
to
access
dust
the
particles,
students'
so
name.
it's all
I'm
over.
gonna write out 1, 2, say like 10 sets of index cards. Watch.
That was the perfect
I know
moment to
supply.
just listen.
Alright, so you guys ready to meet up at some point and do some vitals work?
Oh, we need to meet up at Miss Bush house because she said that
Just
she got dumplings up
unannounced.
at her house.
So we just volunteer in her home. We not even asking. We just gonna find out where she lives. Show up and be
No,
like,
like,
"What's
literally, she
poppin'?
said that
I'm
we
here
could."
to educate
Sees
myself."
me dragging Bradley by the ankles through the yard. Alright, we got him. Pretend he's on a stretcher.
Throw 'em on. Should we be gentle? No. Real world application.
No, but seriously, y'all, she said that we can come to her house. We can schedule
Book
time to
schedule.
She got dummies there,
Show up.
everything.
Just remember,
She
we're
was
all
like,
kicked out by
"Grandma,
9.
Alright then, I mean, I'm down. Either way, we gotta meet up for some vitals.
It's Irene?
No, yeah, it's raining now,
Oh.
but I was trying to get into the, student center where,
We can do
where you can
this.
stay in those little cubicles and study, but they got the doors locked.
We can break that door down.
Oh, she's been in the day.
So this is what we're gonna work on today, is we're gonna work on patient assessments, and again, you've got the kind of script, but we need to start engaging the repetitiveness of this, because again, if you understand the primary assessment is for you to develop a systematic approach to every patient. You have to do that. If you don't, you're gonna miss key information about your patient, and you're gonna look kinda
You can say it.
stupid in front of a doctor, okay? Especially when you're coming in and you didn't do a proper assessment, or you got so focused on the one complaint that you didn't take the blinders off and didn't see the full patient for what's going on. And then, yeah, well, she was complaining of, she had a cold and fever for a couple days, but you failed to see that her legs were like swollen this huge, and she had had some nasty sounds when she breathes and things like that. So again, is to develop a systematic approach.
Hopefully my paramedic don't let me look stupid.
No, he's probably gonna. That's the reason we're getting sued, not me. That one.
Okay,
It's
so
scapegoat.
again, the scene safety, your safety, and the safety of your crew comes first, okay? Number 2 has a lot of details under it, but again, you want to know the general impression of your patient, the level of consciousness of your patient, number of patients, additional resources, MOI and or NOI of the patient, and whatever else you want to throw in there, okay? Again, I think it's here under your general impression, again, under your medical assessment, is C-spine a consideration? And again, I'm trying to get this taken off the medical portion of National Registry. If you're considering C-spine, it now turns into a trauma patient.
That's my day.
Plain and simple, okay, so, but for your knowledge of your checkoff, this goes here, okay?
I'm gonna always think it's strong.
Okay, and then we have ABCs, airway. We need to ensure that it's open, patent, and clear. We secure that airway one of 2 ways, an MPA or an OPA. Then we have breathing, which kind of corresponds with airway and the fact that we need to know the rate first,
Quality character.
Now, if we determine that O2 administration, that will be determined here.
I like it.
Okay, so 5 is circulation, your ABCs.
Great.
Again, we want to know the rate first, the quality, and the character.
B comes in.
You're not gonna do it.
Yeah, I know. I'm an A.
You're gonna aid. Yeah, you're gonna handle
No,
the stuff. Oh.
Okay, so long sounds would go there, okay? So under circulation, we're just gonna kind of shift this up here. Okay, so CRT should be less than 2 seconds, which is
Capillary response time.
Refill time.
refill time.
Hey.
Well done.
Okay,
I know what I'm supposed
now
to do.
remember that this is about perfusion. We want to see that blanch and we want to see it come back very quickly because that means that the body is performing perfusion all the way to my fingertips. If it's delayed in any way, then red flags need to go off. Then we want to know the skin color temp.
CWD.
Put a turquoise. Tracking?
I already wrote that down.
Blood pressure.
Yeah, you put all this stuff down there.
Well, most of it.
Okay.
Looking at the bit.
You should have this down, Joseph.
Blow it.
It's all going on with this one.
All right, all right.
Everything back on the disc.
Michaela and Abby are both still out, yeah.
That'd be here Tuesday.
Yeah, I talked to Michaela.
Should be here Tuesday.
No, Michaela?
Well, Abby.
Oh, yeah, yeah. I know, Abby.
Michaela's still got time though. She hasn't gotten her test back.
Yeah, Michaela
Okay.
still hasn't gotten her test back.
Yeah.
The first one was,
I have no idea. where it's
They
Inaccurate.
jacked up.
yeah, the first one was inaccurate. The second one she was supposed to get, like,
It should be
earlier, but they
taking
still
more
haven't
48
get it.
hours for this stuff.
Hold on, she told me, like, a good, here.
That's so bad.
Still waiting, yeah.
She's gonna be out of class for that.
Yeah, I mean, that's why we got everything on the Discord.
Yeah.
Video.
Yeah.
It's not the same, man. It's not the same.
I know.
Oh, so I like to put on.
Yeah,
She got
getting
tested for
yeah.
that. The first
The
one
wrong
failed, the second one's still up in the air. For, how long's it been? 5 days now?
Yep, yep.
Okay, so
Saturday.
one of the things that we're gonna work on today is the actual,
Blood pressure.
the blood pressure, and how to obtain the blood pressure.
You stick this, right here, and then how they took me when they took me
In line with the
med
heart.
school at August.
Don't you remember in line?
No, they took me. one
Okay,
because they were-
so,
I was going-
This is a teaching stethoscope. And so basically what we're gonna do is we're gonna take a table and set it here, and then I'm gonna walk it through with you, each of you, so that you can hear someone's blood pressure. That means that we need volunteers. Sharon, thanks, appreciate you. Like, oh man.
I was gonna say, you want the Italian, it's pure like marinara. Sorry. Like someone with a normal blood pressure and then versus
Yeah. Not necessarily normal, it's just so that we can use the,
My resting heart rate.
the normal blood
Heart
pressure
rate.
cuff line.
Well, it's 5 times. But my resting heart rate is 4. 4?
My heart beats once a
Cool.
What?
Come on down, Hannah, you're the next contestant.
On the class is
Looking at that stuff behind you on the floor of that blue box, and hand me a couple of blood pressure cuffs, please.
I got trauma. You can tell me what I think everything. That's my problem.
Okay, so,
I'm going to.
remember that when you are listening with your stethoscope, that one, you follow the rules to using the stethoscope in order to ensure that Sharon, come on here, Sharon.
Yes, you
Right here, right here. ensure that you're following the rules to the blood pressure cuff and how it works. Remember that the blood pressure cuff and the bladder itself is supposed to 2/3 around the arm. Some books say 40%, but again, 2/3 around the arm in order to ensure that we get an accurate blood pressure. Anything that's too big on her arm, let's say I was to use that large adult blood pressure cuff, am I going to get an accurate blood pressure reading? No. And if I use like a pediatric on her because her arms are pretty skinny, am I going to get an accurate blood? No. So make sure that you're following the rules to your blood pressure cuff. Okay. And part of the reason why I volunteered, sorry, Sharon. Part of the reason why I volunteered her is because I know that this will fit her. Okay.
I think she just said you need to eat more. Like, your mama don't feed you. What?
Okay. So one, it's important that you put it in the right place. Look, this thing's got artery written on it. So
Yeah, I see that.
okay. And
Artery.
okay. Y'all might want to come this way, Bradley. For book knowledge, all right, Joseph, grab the other end. Okay, make sure that this one you can hear. Okay, so for book knowledge, right, it tells you to kind of get situated, get ready. Hang on a second, let me make. Okay. Book knowledge, it tells you, okay, you're supposed to find her radial pulse. Once you find it, you're supposed to, again, blow this thing up until it disappears and then add 10 or 20. And then you get ready to listen. Systolic is the very first beat that you hear as it comes through, as the blood pressure is being released. And then you watch the knob or the dial as it goes down. When it disappears, that's your systolic. Now, you cannot have the needle going doop, 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 as you're going down. It needs to be a nice steady flow in one direction. Ready? Did you hear it? So she's got a blood pressure of like 126/70 because we are auscultating the sounds. When the blood pressure cuff is completely inflated, it basically cuts off the artery flow. As you're releasing it and as the needle is coming down at a nice steady pressure, that first beat that comes through that artery that you've just occluded, that's the systolic. And so as it completely deflates, then that sound is going to disappear, and that is your diastolic number.
I gotta
Second
see
gear.
the diastolic one I'm talking about.
Wait,
right
what?
now I can't.
First beat.
Yeah, you're not going to be able to hear it, but again,
Fades away
okay.
completely. Diastolic.
Okay.
Now, here is, okay, that's the auscultated blood pressure. Your palpable blood pressure, or the palpation blood pressure that you will get, is that you'll do the same thing. You'll find the radial artery, and then you'll pump it up. And then as you release it, you're waiting for that first beat to hit your fingers. 108, that's her systolic palpable
And you're
blood
just
pressure.
getting the systolic.
That's all you're getting is the systolic.
When we talk about
Yeah, okay, so that's how that works. And again, we normally use the palpated blood pressure if they've lost a lot of fluid, blood, things like that, and we're just trying to get a quick indicator of what her systolic is. And it, also for medical patients who's lost a lot of volume, whether it be through nausea, vomiting, diarrhea, or the fact that, let's say she possibly overdosed on a water pill and she's been peeing galore, and now she's like really dehydrated because of it. Because again, you can overdose on a pill, not really understand the consequences of that, but there can be an interstitial fluid shift that can make her hypovolemic, and she's not overly peeing or vomiting or having diarrhea and stuff. So again, this is something that you have to, one, take your time with, and two, develop now in a nice, quiet environment. Because when you're out there on an ambulance, the back of that ambulance, you're going to hear every nick and cranny, even the sirens when they're going.
Okay.
was hearing her talk that entire time as a secondary through this. If sirens are going
Okay,
off.
and that's just because of sorry, these are crappy, but that's why.
Oh, okay.
They don't make like Littman teaching
Teaching, yeah, I
stethoscopes, because
didn't
that would
see
be
that.
like the first thing I would buy
Yeah.
right now. Because these things, again, they're single inner tubed, they're not double tubed like the Littmans are, or some of the higher quality stethoscopes.
You need to start like a GoFundMe for the
What if we
class.
like dissect them and kind of like put them together?
Yeah, no, I
Put some, like,
almost,
Celine
I
Dion
thought
in the
about
background,
that.
just show a bunch of us out in the field using like paper and rocks.
Yeah, no. Okay, so again, this is something that you have to learn how to listen for. There's going to be those little old ladies where their systolic is going to be very difficult to hear, and if you don't have a good stethoscope, you're not going to hear it.
There's some cool attachments where you can get like a noise cancellation thing placed in, but I think they cost like $300.
Yeah. So again,
So that's a
you
lifer.
know, but I mean,
Back of an ambulance, that might be worth it.
if you're going to be in the medical field, whether it be in EMS or any other field, invest in a good stethoscope. I've had mine for 22 years and it's just now falling apart, and I really need to replace mine. But for 22 years I've had that, and working at Grady, you can imagine what it's been through, okay, and the stories it could tell, okay. I'm just saying. But luckily with Littman, they have replacement parts. You can replace the earpieces, you can replace the tubing by itself, you can replace the diaphragm, the part of the bell, and things like that. So they do offer that. Whenever I got mine at the time, we had an agreement with Littman at the time for replacement parts for free. They would come once a year and they'd check out all of our stethoscopes and replace all the parts, even give us a brand new one if it would, was beat around them. So yeah, Littman's a pretty good company. Not saying that that's the only one, because there are some Alf brands that are just as good. But you will pay, kind of top dollar, because Littman is one of the best. Now, for those of you that are hard of hearing, they do have an electronic type of bell adapter, if you will, to a stethoscope, and it actually amplifies the sound of the bell. So there are some other options for those of you that are hard of hearing.
Which one do you have? The massive cardiology one? Yeah, I figured.
Yeah, because it's got a
I've
heavy
seen it,
bell.
yeah.
Yeah, and it's not necessarily one that kind of flips like this. I wanted one that was stationary. So,
Okay.
so I believe it's the Master Cardiology that it just has the